All right, so we want to begin by talking about an observational assessment of the foot and ankle. And as you're looking at your patient or client, you want to make sure that they've removed their shoes and socks so that you can visualize the foot, the ankle, and kind of the surrounding skin, looking for any patterns of kind of remarkable findings. And so you want to either start proximal to distal or work distal to proximal. So if we start proximal to distal, we want to look first and foremost as we kind of move down the anterior portion of the tibia at both the medial and lateral malleolus. And we want to make sure that we identify those areas, and then we can either move to the medial or to the lateral aspect of the foot. Now, as we move into these different areas, things that we're looking for are perhaps areas of skin breakdown or callus formation, even deformities that may exist within the foot and ankle. One thing you'll notice if the foot is more petite is that you may see the fifth metatarsal head emerging just a little bit on the lateral side. Note that that's an area that's common for pathology, avulsion fractures, stress fractures, things along those lines. And you should be also able to visualize some of the tendons as they come down across the dorsal aspect of the foot. Additionally, you can look both medial and lateral as we get towards the met heads. And this is where you're wanting to begin to look for not only callus formation, but also alignment variations. And so if we're on the more medial aspect of the great toe, we can start to look for significance of hallucis valgus, which would be where the great toe begins to track more laterally, and we see kind of this pronounced area on the medial side that could be an area that there's callus formation, or we could also have a corn or a bunion that's beginning to form. We can also see it on the lateral aspect with the fifth digit or the small pinky toe. And corn and callus formation is very, very common here on that lateral aspect. Specifically, if someone is in a shoe that has a very, very narrow toe box, what can end up happening is, in essence, they get very, very narrow as they move towards the distal toes. And so both on the medial side as well as the lateral side, you'll begin to see it kind of go in or angulate in. And what that does is it creates areas of rubbing or areas that might have more irritation, both medial and lateral. Additionally, we can visualize any type of skin breakdown. Specifically for older clients, they may not be able to visualize the underside of their feet. And so you do want to come around to the more plantar aspect and do a visual assessment there. This is a great time as well to look at protective sensation or just a sensory exam in general. Additionally, while you have the individual in this position and you can observe the foot and ankle, note as well overall health and hygiene of the foot. The foot spends a lot of time in a sock and a shoe, and so oftentimes that can contribute to different types of pathology, fungal growth, things along those lines. So make sure that you're assessing that and looking at that in a comprehensive fashion. Finally, it's difficult to visualize in this position. We could have the individual flip to a prone position, so we'll have our subject flip over onto their stomach. And one additional piece that we can then look at is the more posterior aspect of the foot and ankle. And the reason that we want to visualize this is if an individual has a past history of Achilles tendinopathy, perhaps an Achilles rupture or something along those lines, oftentimes we might see nodular thickening of the Achilles tendon itself, or there may be kind of an inflammatory presence that is visually observable. Additionally, if the individual has a history of pain at the insertional site, we may be suspicious of pathology known as Hageland's deformity or pump bump. And that can be visualized at the more proximal aspect of the calcaneus. And we sometimes can see a little bit of a protuberance or an eminence there that can clue us into that pathology. In this position as well, we can visualize the distal portion of the calf muscle complex. This is a great opportunity to perform any palpation, both from the medial and lateral aspect of the gastrocnemius, but also into the soleus. And so If you haven't already completed your observation of the plantar aspect, this would be another opportunity to look there, looking for callus formation and other kind of remarkable signs. So hopefully that gives you a little bit of a window into how to perform a visual assessment. The only piece that we're not looking at right now is the weight-bearing aspect. If we wanted to, we could have this individual stand up, and specifically what we would be looking at that point is the degree to which that medial aspect of the foot begins to kind of flatten out, right? So that gives us a bit of an idea as it relates to arch types. Is this somebody that has pes cavus, that more kind of higher arch, somebody that has more of a normal foot posture, or somebody that's pes planus, which is more of that flattened posture of the medial longitudinal arch? And we see that in individuals that overpronate in weight bearing or stance. So take an opportunity to go through this observational assessment with a peer or a colleague and enjoy.